Esto es Conexión 1113. Indetectable es igual a intransmisible. Invitado especial, Bruce Richman, director de Prevention Access. Bienvenidos a otra edición de Conexión 1113. La noche de hoy, pues nos sentimos contentos de tener al creador de la frase I es igual a I, U es igual a U en inglés, y está con nosotros para acompañarnos. Se llama Bruce Richman y lo tenemos en línea. Hi, Bruce.
Hello, how are you guys?
I'm fine. Welcome, and it's such an honor to be with you tonight.
Excellent. Well, thank you for having me. It was an honor. I was so excited to be asked to chat with you.
The honor is for me and for us. Bruce, as I make the presentation and I told that you are the creator of the message U is equal to you, can you please tell me how you inspired to create this message?
I was diagnosed with HIV in 2003 and was really depressed and self-hating and felt so afraid of passing on HIV to someone that I would love. So I just didn't love, and I was very withdrawn. And then I learned that the medication that I was taking every day to stay healthy also made it impossible for me to pass it on. My doctor told me this in 2012, and it changed my life. I mean, first, I was so lucky to have access to treatment that would keep me healthy. And now I was just, mind blown that I could be intimate, I could have sex, I could conceive children if I want, without any fear of passing on HIV. And then I realized, though, that people weren't being told this, and message wasn't getting out. The science that was proving that undetectable viral load is untransmittable was staying on the shelf, and science on the shelf doesn't do anybody any good. So eventually I got sort of fed up and knowing this myself and seeing that only very privileged people knew that it was true and were enjoying this in their own lives. They were enjoying having sex and intimacy without any fear and conceiving children, while millions of people weren't being told. So that's where this sort of came from, as I said, I need to do something. And then I was fortunate to meet some incredible activists and journalists and scientists who felt the same way. And so we really all, did this together. The 2015 is when we started Prevention Access Campaign as an organization, and the plan was to launch the U equals U movement in the summer of 2016. The movement was going to launch with a statement that we created with the top scientists who studied HIV transmission risk. And that statement said, U equals U is true. It basically was something to prove that this was indeed true. All of the body of evidence, not just one study, but all the groundswell of evidence dating back to the early days when antiretroviral treatment became available is pointing and confirming that we can't pass it on. And we created a video, advocacy video with the voices of people with HIV from every key affected population demanding the truth about our bodies. And so we launched with this video and the statement, and we went out to recruit influential people and organizations to join us in confirming the truth and change the narrative about our bodies. And that's when it started in 2016. And it just it really took off because so many people like you, cared enough to speak out and to challenge the system and challenge the establishment in their countries and say, we demand the truth about our bodies. People with HIV have a right to accurate information about our social, sexual, and reproductive health. And this is the truth. And you'll better tell the truth or we will tell it for you. And that's how it really started, summer of 2016.
Do you have any idea how many places right now, how many countries the message is available?
Well, it's at least 102 countries because there are organizations in 102 countries that have signed on to the campaign. So there are probably more, But these are countries where organizations have actively, agreed with U equals U, signed on to the campaign, committed to sharing the message. So we know at least there are pioneering people in those countries. We don't know what's being done in all the. It's hard to find out what's happening in 102 countries, but we do know that at least there are people on the ground that are committed. And what we're doing now is making sure that we support them and learn from each other. There's this huge network now, U equals U movement, and our job now is to support each other and learn from each other.
Do you know how is the impact of this message of doctors or nurses on the medical staff?
Absolutely. Well, it really depends on the country, but there's still the biggest resistance is from the medical community, not the highest levels of the medical community, because you have the WHO, PEPFAR, UNAIDS, the CDC, CDC Global, NIH, health ministries around the world are on board and have signed on and have their own U equals U, K equals K, B equals B, N equals N, H equals H statements. They're there, but the doctors who are sort of making decisions on their own and not paying attention to the guidelines and thinking, it's very paternalistic. Doctors, there's a history of, at least in the United States and some of the other countries we work with, there's a history of paternalism and prejudice in the medical field and in public health, where people believe that they can make decisions for people with HIV rather than join us and make decisions together and inform us with the right information. So we do have that challenge. Usually the healthcare providers who are resistant will say a few things. First, they can't combat the science anymore, because you can't really, you can. There are still people who believe the world is flat and that global warming doesn't work, but isn't true. But the science is there. It's proven at the highest level. So we have all that ammunition basically to use. But when a doctor says, I don't want to tell my patients because they're not going to understand U equals U, my patients, it's just too complicated. And then we say, well, it's up to you to explain it to them. That's what you do, is you tell them the truth and explain it to them. You just, medicine only works if you take it. That's a very easy thing for basic to understand. You take your medication as prescribed, get your labs done, and stay in care and go and live your life, and enjoy yourself. And it's not that complicated. But they try to make it complicated and say that their particular population won't know that if they, for instance, they stop taking medication, the viral load will go up. And what happened, and then they'll start transmitting HIV to people. So that's the one concern. It's called the unsophisticated consumer. And the second concern, both of these are ridiculous. The second concern is, well, if I tell my patients that, they're going to stop using condoms. And there's already a rise of other STIs. So we don't tell them that, which is just basically lying, completely lying to people to prevent them from getting a separate disease, which has nothing to do with whether or not someone can transmit HIV. And there's no medical justification to withhold this information. So what we end up saying, this is what we teach people too, is when you have doctors that are like that, that are just entrenched. And a lot of it comes from prejudice against people with HIV, the kinds of people who have HIV. We're Black, we're brown, we're gay, we're transgender, where people inject drugs. There's all this prejudice that these folks think they can decide for us. So what we end up saying is, your patients are gonna find out elsewhere. Well, first we say this. Okay, I should step back. First we say, you're gonna be wasting your personal and public health opportunities here. Because when people with HIV know U equals U, when they're informed by their doctors about U equals U, there's evidence, a new study called Positive Perspectives 2, that shows when people with HIV are informed by their providers about U equals U, they report better adherence, better viral suppression rates, better treatment satisfaction, mental health, sexual health, willingness to disclose their status. So there's all kinds of benefits that you'll be wasting if you don't share this message. And number two, we know that the more people who are on treatment and undetectable, the fewer new transmissions there'll be. You would be wasting an opportunity to improve community health as well. So that's the first thing is appeal to those wasted opportunities. And the second is appeal to their ego, where you say, well, your patients are going to find out elsewhere. They will, and they are, and they're going to fire you if they have the luxury and go somewhere else, or that's going to break trust between patient and provider. And you're going to be known as the provider who lies to their patient about and tells patients they're infectious when they're not. So there's lots of stuff that we've had to do. It's not fun. It's definitely not fun trying to convince these, sometimes people of influence and stakeholders, gatekeepers, to get this message out. But it's working. You just have to stay on it. You have to stay on it and sometimes be a little aggressive.
How you think it's going to work your message in countries where there is a lack of medicine or it doesn't have a viral load test? How you just tell the people, yeah, if you're indetectable, you're untransmittable, but you can, for example, prove that he's undetectable because you don't have a viral load or you don't have the medicine.
Yeah, and that's a really good question, and that's why when you told me about how this is still giving hope to people in Venezuela, it made a big difference because of it's hard to know how this is impacting people who have limited or no access to treatment. There's two things. One is what we call the public health argument, and it's in our advocacy to increase access to treatment or care or viral load testing and remove barriers. We in the past have often used just a personal health argument that this is for the health of people with HIV, for the well-being of people with HIV. But now we can also use the public health argument and say that, look, if you invest in the well-being of people with HIV, you're also investing in public health and in the community, because the more people with HIV who are on treatment and undetectable, the fewer new transmissions there'll be. So you want to end the epidemic in your country, wherever it is, make sure people with HIV can get the treatment and care that they need. So we have this new argument now, or policy rationale, and it's new. So I'm not sure where and how it's working that much. It's still, a lot of people don't know it yet. We just had advocate training recently. We saw where hundreds of advocates were trained, and they weren't trained in the public health argument of U equals U. They were just trained in we need services for our own health, which again should be enough, right? We should be able to go to the policymakers and say, we need housing, we need healthcare. As people with HIV, it's our right to health, but we've got to use the public health argument. So that's number one, is that this can be used in advocacy. This can be used in advocacy to change treatment access policies and to encourage viral load, more sensitive viral load testing and access to viral load testing more. And that's so we're on the cusp of that. So we'll see how that goes. And then secondly, it is spurring new activism. We're seeing people rise up and they're demanding access to viral load testing. So it's sort of this, they're demanding treatment. They're demanding, they have more hope. Before treatment, this gives people, I was that person who, when I was diagnosed, I didn't want to live. I thought I would be infectious forever. But the idea that I could be quote unquote normal again and have that intimacy in my life and not have to be afraid in those intimate moments, changed it for me. And I think what's happening is in places where there are these barriers to care, that people are rising up and they're saying, they say that treatment is more than just it's more than medication. It's more than just keeping me alive. It's giving me a new life. It's giving me a new life. It's giving me relationships again. It's giving me intimacy, sex, conceiving children that I was told I would never be able to do. There are all these things. So that's priceless. So you've got this as a public health argument and a strategy, and then you've got the hope that it's giving to people and the generating this new activism that we're seeing around the world. Does that make sense?
Completely. And how with all those arguments, how do you feel the future of HIV in the world?
I think there will be a vaccine soon. I don't know. I mean, I'm learning a lot about the industry. I've only been in it for 5.5 years, and I'm learning it's a business. I mean, it's a big business, and I'm not 100% sure a lot of people want to end HIV. I remember when I got into this field, a few people had said that, AIDS Incorporated and all this stuff, and and then I started observing things from very early on where the focus seemed to be more on people keeping their jobs and keeping power and money rather than actually serving the people we are supposed to be serving. And I'm not sure. Yeah, I think that there's a lot of, I think we have a lot of work to do. I think we need new leadership. We need change in many different parts of the world and in the field. And I'm hopeful things will change as long as people like the people in the U equals U movement keep speaking out. Because what you'll see is the people in this movement are pioneers. They're the originals. They're the ones who are like saying something that is not popular. Initially this was not, for 2 years, 3 years, this was not popular, as you probably experienced there. They would speak out against the establishment that would push them back. And now that it's become, it's part of the establishment, those folks are still there in the establishment who tried to silence this and push this down. So what we need to do is make sure that these innovators, these originals, the ones who are like marching in the streets, coming up with their own incredible campaigns, volunteering with no money whatsoever, zero resources, in creating national campaigns in many different countries, whether it's Uganda or Australia. It's like these are the people that need to lead the global response, because their hearts are there. They're passionate about it. They are excited about change and information, and they're not the ones who cut people down, so I think that's going to happen. And if there's anything that I do before I die in my next, however many years I'm here, is I want that to happen. I want to see the leadership that we need and deserve, not just to end the epidemic, but to protect the well-being of us, of people with HIV. It's not just about ending the epidemic. It's not just about ending HIV, because people with HIV are still going to be here after the epidemic ends. And we need to be treated with dignity, especially long-term survivors who've been here and in the United States get so pushed out to the side. So, but I think the change is coming. I'm excited about the U equals U movement. It's just, I'm so honored to be a part of it. I'm so humbled by people in it. I'm constantly saying, I wish I were more like them and them. And I'm learning from so many people, and it's underground. The movement isn't really, it's huge. I mean, it's 102 countries, but it's not yet. You will see in 5 years how people look back on this time. And I think that they'll see some pretty extraordinary risk takers who made change, like you. I mean, like you. This is why I'm so honored to be able to talk with you. I'm just like, I'm blown away. I'm probably going to start crying.
No, please don't. I feel really proud to use this message and to say that it's not only to get this t-shirt and just show the message for all the people who are living with HIV. I'm very proud to know you and say that I'm your friend and you are an amazing person. And one message, please. Short, one message to end this interview for all those people who are watching you right now, who are living with HIV and trust you.
Right now, millions of people with HIV around the world are learning that we can love, we can live, we can have sex, we can conceive children without any fear of passing on HIV. And all of us together have to make sure that everyone knows this. It's going to be up to us. People with HIV drove this movement for the last 5 years in 102 countries, and we have to keep it going and just keep spreading the news. U equals U, I equals I, in whatever way that makes sense. and spread the love and the hope and the freedom.
Thank you, Bruce, again for this interview. Thank you for your time, and thank for all the change that you made from all the people who are living with HIV.
Yeah, so thank you for having me. I was really honored, and I can't wait to show this to folks, because I think, you know, connecting to Venezuela, connecting to you in Venezuela is very, very meaningful to me. And knowing what you're going through and how much hard work you put into this is it's inspiring. So.
And you are the inspiration. Thank you very much, Bruce, for your time. Y gracias a todos los que estuvieron con nosotros en la noche de hoy. Los esperamos en otra edición de Conexión 1113. Thank you, Bruce.